Subject attitude was another threat to the study because we were assessing preteen and teen adolescents, and their motivational levels and ease of cooperation vary greatly most of the time to completing a task, so we had to make sure that we were implementing real life situations to keep them entertained with our study. Implementation was another threat that we had to consider. If the implementation of counseling techniques in the biweekly sessions were not effective, then students would never grow or learn those coping mechanisms. So we had to watch and document those greatly. Regression was another threat. Instead of students improving from counseling, students could regress because they may not want to talk about their feelings because they're worried about that social side of opening up. So we established student-led counseling sessions. External validity, all passing students in the 8th grade are taking steps toward entering high school, so they all are possibly having those added stressors on academics and social behaviors. So the study could be generalized by having a representative demographic of the county which it takes place in. And the study would need to be held in a junior high setting with 12 to 13-year-old adolescents. Confidentiality, there were a few possible problems that could arise with this study. If students put their name on the pretest survey, then that would be revealing their levels of anxiety. So to handle this, we did not place a name portion on the survey. And if the students wrote down their name out of habit, then we gave them a new sheet and shredded the old. The second possibility of confidentiality breach would be if the students were in the counseling sessions, then they left the counseling sessions and told others around them who was in there with them. So we had to place an importance on keeping the names of the group classmates confidential. The special populations that we dealt with throughout the study were low to middle socioeconomic status adolescents with Caucasians, African Americans, and Hispanics, and we had a few of the special needs population as well. The IRB level that this experiment held was the level 1 because there were no real risks to involved human participants. The results for the pretest for all students, it was a surprising situation because we saw that there was a moderate anxiety, 37%, when it came to academics or social stressors, and slight anxiety, 14%. Only 8% of the students did not have an anxiety to the situations. The extreme anxiety, there was 19%, and strong anxiety, 22%. The experimental group results, this was the post-test, and we had a decrease in extreme anxiety from 12 to 9%. No anxiety went up from 8 to 12%. This was given with only the experimental group. Strong anxiety, 17%, moderate anxiety, 33%, and slight anxiety, 29%. So we did see that some of those coping mechanisms were helpful to the students. Achievement growth, grades were noted at the beginning of the experiment, and then at the end of the experiment, most students in the the experimental group increased their average in a reading class by an average of 4 points. An overall observation of their demeanor during certain stressful situations also saw a decrease. Possible changes to be considered when looking back upon this study. Revisions, I would say that there needs to be a more diversified population. This school population that was dealing with was not as diversified as it would probably need to be the most effective. Greater special needs presence in that given school or in that given experimental population. Greater research can be conducted on more studies where counseling has been employed as a method of diminishing the overall problem at hand.